Dear friends, I am happy to see you on this Saturday, 28th September 2024, because it is a great day for me. Because today we have finished 1,476 cases of Puberphonia. We feel really it is an achievement for us, and telling the people that we are able to treat Puberphonia without any surgical intervention, without any medicine, just by training itself. And there's no necessary for admission in the hospital also. But we will give rooms for the boys who are coming from outstation, because our treatment starts by 10 a.m. and the training finishes only by 6 p.m. because it is a continuous training that only initiate them to have a good low pitch voice. Everybody know that we can change the pitch, yes, but how to maintain it, that is the typically we are able to do it. How we are doing, it is not a magic. We teach them abdominal voice. This is what already told in Tamil literature. The voice should come from abdomen. So how to talk from the abdomen? Okay, this is the training we used to give to the boys, and they will be able to talk. பார்த்து பார்த்து ஒன்றும் அவசரம் இல்லை. So we'll be able to give a voice from abdomen. That is the technique of our therapy. Number one, the voice should come from the abdomen. Second, it is should manipulated at the uvula level, and the resonance should come from nasopharynx. Three techniques. So we have boldly given the name as uvula manipulation. This is not the only treatment available for Puberphonia. This is one another treatment. We are following it for the last more than 5 years and doing uvula manipulation for treatment of Puberphonia. We are doing lot of scientific work also, because so far in uvula manipulation I have written 6 books. Out of that, I am more fascinated with Tamil literature, so 3 books are in Tamil and 3 books are on English. We have already published 12 national and international articles on Puberphonia. Among them, 2 only in Tamil literature, other 10 are in English in international reputed journal. So I had become a Google scholar along with my son, Dr. K. Naveen Bharat. Now what happened is, very interesting things happened. Google has accepted and included uvula manipulation and resonance, one of the treatment for Puberphonia. This I personally feel a very big achievement, because I am thinking who will recognize my method of treatment for Puberphonia. Doctors definitely will accept when it is more beneficial for patients, and lot of evidence available for treatment. Yes, evidence available, Until today, we have treated 1,476 patients by ULAM manipulation. So, sufficient evidence are there. Still, doctors are hesitating to follow. 3 doctors are doing our procedure. Only 2 are from India and one is from foreign country. They have written articles and published in the international journal, and they given the reference. Dr. Kumaresan is doing EULA manipulation. So 3 references are available in the international articles. So that is a very big achievement for me. They accepted that Kumaresan is doing this job. Dr. Naveen Bharat is doing the job. So what more I want? Still, doctors are having some idea how EULA manipulation will treat puberphonia. Yes, that Google has accepted by seeing my articles. I hope so. How Google had accepted the series of articles I am given in the national and international journals, they are aware that some fellow from Chennai, if I name Dr. Kumaresan, is doing EULA manipulation and resonance for the treatment of puberphonia. They have not directly told the Kumaresan's topic is very popular or something like that. No. They have told in their performa what are the treatment available for puberphonia, because so far no standard textbooks are available. The secret is I am writing a book, but how can you say that it will be a standard textbook? They will say the gold standard for treatment for puberphonia. Still, they have not come with the idea. What is the goal? Because a lot of treatments are suggested for treatment of puberphonia. So now Google is enumerating what are the treatment available for puberphonia. They give the list. What are the techniques? How it works. So they say first larynx manipulation. So what are the treatment options available for treating puberphonia? Google enumerate what are the technique and how it works. Number 1 is larynx manipulation. Manually move the larynx down to lower the pitch of the voice. So this is what are the accepted therapy. Okay, these are all non-surgical treatment. Okay, so the first treatment is larynx manipulation. How it works means manually move the larynx down to lower the pitch of the voice. That is the number 1. Second treatment, vocal exercise. So you can do exercise and treat it. This is what speech therapists are doing. What are the vocal exercise? Yawning, sighing, coughing, humming can help to relax the laryngeal muscles and lower the pitch, which result in effective closure. So great thing. The fundamental thing is relax the laryngeal muscle. So this is the original idea. Puberphonia is a hyperfunction voice disorder or hypofunction voice disorder. There was a suggestion that it was a hyperfunction disorder. Personally, I am not favor for it. That had given me an idea. It is a hypofunction disorder. Everybody feel, everybody not like that. Somebody feel, some good ENT surgeon feel when the voice had a high pitch, which is not changed to low pitch. That is puberphonia. So the voice will try to adjust the larynx, hyperfunction, and make the voice as low pitch. This is originally suggested. But my feeling is it is a hypofunction of the larynx. What is meant by hypofunction of the larynx? The whole larynx will become lazy. The 1,476 cases I had seen so far until today, Saturday, 29th September 2024, all the larynx are hypofunction. They become lazy. So, this therapy, everybody feel that it is effective. In my hand, it is not successful at all. That's all I can say. So, good people are doing it, still taking the treatment and getting the success. So, that is the second. Then, the Google say uvula manipulation and resonance treatment. This treatment is suggested only by me. Uvula manipulation and resonance. How it works means practice uvula resonance with forcible airflow from the stomach or diaphragm. So this is also accepted as another way of treatment for puberphonia, uvula manipulation and resonance. That means this treatment is found out by me, Dr. Kumaresan, that's all. They have not told that this treatment is by Kumaresan. But if anybody want to know about uvula manipulation and resonance, if they put in the Google or any article, then means they have to follow Dr. Kumaresan's technique. That's all. That is what already followed by 3 ENT surgeon, 2 ENT surgeon in India and 1 from foreign countries. You can have a reference from their article. If you just type puberphonia, my article, 12 articles will come. But other ENT surgeon, I personally feel lot of more than 500 articles are there. Each will have one. That's all. I don't know the second article by that same author because I am interested only in puberphonia. Now the whole life I want to spend my life only for one disease. My hospital will function for one disease. So I am going on writing, thinking, writing, and imagining when eating, sleeping, or taking bath. Only I am thinking about puberphonia. That is why I am able to give 12 articles in the national and international journal. 1 week back only, Google enumerate the treatment for puberphonia. They have included this treatment is also available called as uvula manipulation and resonance. How it works is practice uvula resonance with forcible airflow from the stomach and diaphragm. Euler manipulation resonance is my word. I have only introduced this word into the society in the medical fraternity. Practice Euler resonance is my method of treating puberphonia. Forcible air flow from the stomach and diaphragm. This may have been told by many people, but how you can bring a forcible air from the stomach or diaphragm is one of the method is our method. Okay, these three method I have told, that's there in the Google. The fourth method is half swallow boom technique. The boom technique is just after swallowing and repeat while turning your head and lower your chin. That is the boom technique. Other treatment available, other treatment option available are, very interestingly, Google is telling, yes, then direct voice therapy, which include counseling and good voice hygiene, audio visual feedback, and Botox injection, lastly surgery. So these are the treatment available now for puberphonia treatment. I greatly acknowledge that Euler manipulation and resonance is not the only treatment available for puberphonia. Please try to understand. There are 10 techniques are available for treatment of puberphonia. They are larynx manipulation, voice exercise, Euler resonance, Euler manipulation and resonance, half solo loop technique, indirect voice therapy, audio visual feedback, Botox injection, and surgery. These are the 7 methods which are available at present to treat the puberphonia. Among them, among them, the treatment available, Euler manipulation and resonance, which is our finding, our method of treating puberphonia. We gladly say that treatment, Euler manipulation and resonance, will succeed all the other way of treatment because we have successfully treated 1,476 patients who suffer from puberphonia. So I don't think so. In my experience, my small experience only, nobody in the world had seen 1,476 cases of puberphonia. They may have seen lot of cases, but not 1,476 cases. I was also a professor of ENT in Stanley Medical College. We see yearly one or twice, 2 cases. Today, we are having 5 cases of puberphonia in my hospital. One boy today came. Why 5 boys mean? We are giving treatment for continuous 5 days. Today, no 5 cases. Today, only 1 case had come. But we are accumulating because it is a group therapy. Mainly, our habituation treatment depends upon the success of group therapy only. That is what we are following. Today, we are so happy that somehow a small happiness had come, that Google has included euler manipulation and resonance as a treatment for puberphonia. Please try to understand, this is not the only treatment available. There are 7 options Google had given the available treatment for puberphonia, surgical or non-surgical. Among them, the non-surgical, non-medical treatment, he enumerate 5. Among them, Euler manipulation and resonance is one of the treatment for puberphonia. I am so happy on this Saturday, 28th September 2024. So this I am informing the medical fraternity that one day I will be able to succeed and tell the people what are the research work we are doing on puberphonia. Happy we'll see next Saturday once again. Thank you. Great, great, great.